Hello, and welcome back to the Transform Wellness Clinic. I am Dr. Bradford Perkins, and today I'm going to talk about advanced lipid panels. An advanced lipid panel goes way beyond the standard cholesterol test you get at the doctor. It provides a much deeper understanding of your individual cardiovascular risk. There are several key components, including the LDL particle number, your small LDL, apolipoprotein B, lipoprotein A, as well as inflammatory markers. We are going to talk about these in detail. So why do we want to go beyond standard lipid panels? Because standard lipid panels miss key risk factors. The advanced tests identify hidden risks for atherosclerosis, plaque formation and rupture, and inflammation-driven cardiovascular events. So the first thing I look at is the LDL particle number, because this is the best correlation with cardiovascular risk, way beyond a LDL calculated, which is what we see on a regular cholesterol test. The optimal number for this test is less than 1,000. The second test to look for is the ApoB, but small dense LDL is the third best. So small dense LDL is letting us know if you're more prone to causing atherosclerosis. So the optimal level for a small dense LDL is less than 162. I'm going to restart. Hello, and welcome back to the Transform Wellness Clinic. I'm Dr. Bradford Perkins, and today we're going to go a deep dive into advanced lipid panels. So the advanced lipid panel goes way beyond what a traditional cholesterol panel looks, because it gets us a deeper understanding of cardiovascular risk. There are several key components we're going to discuss today, including your LDL particle number, your small LDL, ApoB, lipoprotein A, as well as inflammatory markers. So why do we want to go beyond those standard lipid panels? Because they don't give us all the information for what our true risk is. So the advanced testing looks at hidden risks for atherosclerosis, plaque formation and rupture, as well as inflammation-driven cardiovascular events. The number one predictor for cardiovascular risk is going to be your LDL particle number. And the optimal range for that is less than 1,000. Now, if you have heart disease, the optimal number does go down somewhere between less than 500 to 700, but these are for people with average risk. The next test usually reported is your small dense LDL. Small dense LDL in general are more prone to causing heart disease, also known as atherosclerosis. The optimal number on that test is less than 162. The next test reported usually on an advanced lipid test is the apolipoprotein B. This is the second best marker for cardiovascular risk. This is the carrier protein of small LDL. Because fat and water don't mix, cholesterol needs to be carried around in a carrier protein, and that's what apolipoprotein B is. Optimal level is less than 80. For lipoprotein A, this is more genetically determined risk factor. So this is linked to increased risk of atherosclerosis and thrombotic events, that's clotting events. If it's normal, then that's less than 30, that's optimal. And if it's elevated, it's usually related to a genetic risk. There is no current medication to lower lipoprotein A, so there's a lot of different techniques to help lower this risk. Triglycerides, now this is reported on a traditional cholesterol test, but I wanted to touch base into it because this is another independent risk factor and it can contribute to formation of small LDL. Optimal is less than 150. And then we look at the inflammatory markers. So that's a test called high sensitivity CRP or C-reactive protein. This is a marker of systemic inflammation and the optimal is less than 1.0. And the other test is LP-PLA2 activity, and that's a specific marker for vascular inflammation and increased risk of plaque rupture. Optimal level is less than 123. And why does the inflammation matter? Because inflammation drives plaque formation and rupture. Inflammation leads to oxidized LDL, which is not tested on these tests we're talking right now. ApoB, small LDL, insulin resistance, foggy brain, and mitochondrial dysfunction. So that's what inflammation does in our body. And there's a whole other talk to really deep dive into inflammation. What about HDL? Again, this is something reported on a traditional test, but the absolute number actually doesn't mean much. It is not a great indicator of protection. So people that have had these really high HDLs, we used to say, oh, you're protected. Truthfully, that's, in the most part, not true, because it's the degree of functionality of the HDL that's important, not the total number. So there actually is a test. It's done through Cleveland Heart Labs at Quest called the HDL-FXP CAD score. And you want to see that less than 0.9. That's low risk. And what is the role of HDL in general? The role is to reverse cholesterol transport. So it helps get the cholesterol out of the wall of the artery. It maintains the integrity of the inner lining of the artery called the endothelium. And it helps lower inflammation and neutralizes oxidation of LDL. So if the HDL is not functioning, cholesterol is not getting out, the endothelium is breaking down, and you're going to have more inflammation and oxidized LDL. So if I'm looking at a full workup for cardiovascular health, I'm looking at all these labs. I'm doing, a lot of these are just regular tests: CBC, urinalysis, metabolic panel, advanced lipid panel. I usually order the Cardio IQ advanced lipid panel at Quest. There also is an NMR profile that's done at LabCorp or other labs. But you also want to see your thyroid, iron, inflammation, homocysteine is an independent risk factor. There's a long list of tests we would want to look at to really get your full risk profile outside of just an advanced lipid panel. You can also look at your omega-3 status, micronutrient status, and then for people at really high risk, I like to do a Cardia X test. It's a genetic test looking at increased risks of heart disease or high blood pressure. Also get your ApoE status there. For some people, I'm looking at urinary heavy metals. Gut microbiome is also another option. And as far as physical testing, I usually look at a calcium score or a CT angiogram done by Clearly. It all depends on the different risks and what we're seeing and what I recommend. But this is just a full workup for true understanding of someone's cardiovascular risk outside of just a lipid test. So when it comes to treatment strategies, I'm not going to go into this in depth. This is just kind of in general. Following a Mediterranean or an anti-inflammatory diet, because most heart disease is going to be driven by insulin resistance, inflammation, so lowering those types of foods. Regular exercise is really important. Good quality sleep. So you want quantity and quality, at least 7 hours of good quality sleep. Stress management is huge. I mean, those are going to be several different talks you'll be able to see on my channel. And there are going to be supplement recommendations, medication recommendations that go along with it. So key takeaways are that comprehensive testing provides a more complete picture of cardiovascular risk. Treatment strategies are wide and varied. It's not just a statin. And there's a lot of other risk mitigation we can do. If you want more tips, subscribe to my channel for weekly videos. Drop any questions or experiences you have in the comments, and thank you for your time today.